Hi, my name is Van Morris. I'm a medical oncologist in the Department of Gastrointestinal Medical Oncology at the University of Texas MD Anderson Cancer Center in Houston, Texas. So circulating tumor DNA assays in the management of patients with resected solid tumors are very exciting right now, and there's a lot of evidence validating their use as prognostic biomarkers. So we know that when a person is ctDNA, has a positive ctDNA status after their surgery, they're at high likelihood for the cancer coming back, whereas a person who has no detectable circulating tumor DNA in their blood has a much more favorable prognosis and it is much more unlikely that their cancer will recur. The kind of missing piece that we still are trying to answer, which I think does represent not a challenge, but a gap in knowledge before we're ready to roll this out routinely, is what do we do about a circulating tumor DNA positive status? We know that these patients are at high risk for recurrence, but we don't know yet that, and we don't have level 1 evidence yet that standard therapy such as chemotherapy, for example, can clear the circulating tumor DNA and improve that person's likelihood for cure. So there are multiple kind of clinical trials which are ongoing across the world looking to answer this question. But I think that is the major gap that oncologists are missing before we can say that we're ready to roll this out for all patients with resected colon cancer. And this is, I think, very much the reason why the NCCN, ASCO, and the ESMO guidelines have all said that they agree with that statement that we're not ready just yet, but really encourage enrollment on clinical trials so that we can provide patients and oncologists that critical information and evidence that we need.